Hi, welcome to Well Rounded Momma's YouTube channel. My name's Sherry.
I'm Tiffany.
If you find this video helpful, like, subscribe, ring the bell. We thought we would do another reaction video because Tiffany's laughing before we even start. For those of you who haven't seen the movie Baby Mama, we thought that there were a couple clips from there that were pretty funny. They're pretty short.
The first one is a birthing class. Those are important.
Are you ready?
Yeah, I'm ready.
Here we go.
Wake up, partner. It's time for birthing class.
Yay! Welcome to the Birthing Center. In this birthing class, we are going to help you new mommies and daddies, and our mommies and mommies, lesbian lovers, prepare for that marathon of labor. Quick question before we start. How many of you are planning on doing natural childbirth? That's a good show of hands. That's so great. You're all so brave. And how many of you are planning on using toxic Western medications to drug your baby for your own selfish comfort? Anyone?
Now this is the Lexus of strollers. Got an iPod adapter, leather trim. Check that out. Feel
It's
that.
only like a minute.
Back of your hand. Back of your hand. Now, what's
Now
the
they're looking
first
at
word you
strollers.
think of when you think of stroller?
Baby.
Okay, what's the second word you think of?
Infant.
No. It's top of the line safety features. Check this out.
I'll take it.
So last week we shared like why you would take like a birthing class, and I think what's great about the birthing class.
And waiver.
Now I'm going to talk like the woman who was teaching that birthing class.
Wave.
You're so brave.
You're so brave.
Was meeting other couples and knowing what your choices are. And I think what's funny is like this peer pressure to do things
A certain way.
a certain way.
Yeah.
And certainly that's not why anyone really wants you to take a birthing class.
No. Or choose any of your choices.
Yeah.
Honestly.
Yeah. It's all about informed consent. So we're happy
what
about
you want to do.
yes, informed consent.
So while that was funny of her saying that she was choosing Western medicine selfishly, we don't feel like that. Like if you're a mom and want an epidural,
Yeah.
that's a choice. That's
For
doesn't
sure.
make you a bad person.
Maybe a little bit of a bad person.
She's pouring olive oil
As your
into a
pregnancy
little bowl.
progresses, your partner can help you prep your perineum for the great stretch of delivery.
Stop it.
Massage the area daily with a little EVOO to help you stretch and prevent tearing. What is she talking about? I think she wants me to rub olive oil on your taint.
Is it cool? Maybe I just spray a little Pam down in that area right before the baby comes out.
You have to admit it's a valid suggestion.
Spray a little Pam. I mean, I have heard some funny ones. I think a physician one time asked me for the salad dressing when I was a doula. I was like, really?
Well, because the hospitals use baby
shampoo.
because they use it as like a lube. But the
Right.
reason we're not
It's-
really fans of baby shampoo is it's a soap. It's a detergent. It
Yeah.
dries out, so
It's
it might act as a lube, but it causes like.
Pain in your urethra because it's soap?
And as I'm pushing a baby out, I don't think I want soap poured on my
No.
taint.
If you haven't seen Baby Mama, watch it. It's pretty funny.
And so the other part of that we thought we would talk about is the perineal massage.
Yeah.
Neither one of us want to admit what we feel about it.
Well, I don't think it's necessary.
I think knowing your body is important. So if you have
Yeah.
never explored your perineum
Yeah.
or parts of your body,
Yeah.
it's a good idea to know where that is, to know
And the
where
muscles. And,
yes,
Yeah.
what muscles are being used.
Yeah.
And so
That is good.
exploring that, but whether it needs to be stretched or prepared or not, I don't know that is necessary. Now, mind you, we say that because we're home birth midwives. So for us, you birthing in positions that feel right to you are the number one reason why we don't really see a lot of tearing at home.
Yeah, for sure.
And so I don't know, maybe if I was doing deliveries on an exam table,
That might help.
maybe.
Your baby's head does the job.
What I thought was really fascinating is when
don't
we had
spray
taken
tan.
a pelvic They have like olive oil based ham now.
Okay,
You
well,
probably
maybe
could,
you could do that. Or they have coconut oil.
I'm gonna
ones,
get it
too.
out. I don't even remember what I was gonna say. Dang.
That went right out of my brain.
It left.
It left me.
As soon as
And
it
you
came in, it was
left
like.
mine too.
But yeah, I think anything that you do to prepare for labor is fine. And taking a class is really helpful. But I also think you have to talk to your care provider about like what are they doing to kind of help support a pregnant individual while they're pushing a baby out.
Yeah.
Are they going to allow different
What
positions,
positions, yeah.
or
Yeah.
are they going to do coach pushing? Are they going to allow it to be individual led pushing? So I think those kind of questions are more good to ask, I think.
Yeah.
And I think these skits are always funny because it's making fun of things that we have to think about, and it's poking fun at
If it makes you feel
things
better.
we lose
Yeah.
a lot of sleep over.
Yeah.
And I would say a lot of individuals come to the office and do a consult, and some of them, their number one fear is tearing.
Tearing, yeah. Yeah.
I
That's
had a
big
client
deal.
one time, a doula client back in the day, and her partner did not even allow her to try for vaginal birth because, remember that? Do you remember
Yeah.
that client?
Yep.
Because he was so worried about what his client would look like later. You have so many extremes of humans
It's
that
very
you're
sad.
working with, and I don't know that there's right or wrong outside of wrong in that the individual who it's happening to doesn't get the biggest say.
Yeah,
If it's happening to you, you get the biggest say.
for sure.
Yeah.
And if you're having a hospital birth, you don't have to use.
I'm going to make us holsters
shampoo.
with 2 things of Pam on the side and show up at birth, and we're like, we're here.
We're ready.
We're ready.
That's funny.
So thanks for joining us. It's a funny movie.
It is funny.
Wonderful.
It's
So
okay if I spray a little Pam down there.
it's a valid point.
It is. Like, subscribe, ring the bell. Ding, ding, ding.
And share below what
Yeah.
your 2 thoughts were
Yeah.
about perineal massage
And birth glasses.
and birth classes. I don't even remember what I was going to say.
I don't know. I don't know what you were going to say either.
What was I going to say? We were talking about the
Talking
perineal,
about-
perineal massage, tearing.
Mm-hmm.